we all sort of understand now that in the cold plunge, we don't need to take it into such ridiculously low temperatures.
Yeah.
And particularly for women, 10 degrees and up is a better idea because of the stress on the nervous system. What else is there here in terms of the nuances when it comes to recovery? I don't know if I should be asking this question in the context of like a woman's cycle or if there's something else. Maybe if you are dealing with certain types of stresses, are there certain types of recovery you should do versus others? What is the nuance here that you wish women would know about a little bit more?
So I think anybody, and particularly females, when you walk into or you're wanting to look at recovery services, and here I'm talking about, if we look at a contrast suite where you've got a sauna, be that an infrared sauna or a traditional sauna, a cold plunge, so that's your contrast suite, red light therapy, hyperbaric oxygen therapy, right? So if you look at those sort of 4 modalities of services that you can tap into, I think one thing I would like people in general to understand is that how you do it, the sequencing of it, is important. And it's important because we have to take into consideration where you are in that moment in time and what are you trying to achieve, right? So that's where the cycle comes in, right? We as women, we're talking average women here, 28 to 32 days is your menstrual cycle, right? Day 1 is when your period starts. Then usually you bleed anything from 5 to 7 days. Again, here I'm talking average, right? 5 to 7 days, that's the menstrual phase of the menstrual cycle. Once your period stops, right? So remember, you have your period. A female has her period because she has ovulated midway through her cycle and there has been no pregnancy. So the lining that the egg would normally attach to as part of fertilization now gets shed. So menstrual phase, day 1 of your bleed, day 1 of your cycle. 5 to 7 days, then you're going to go into what we call the follicular phase, right? And that's sort of like where your ovary is starting to prepare for this big event called ovulation, right? And usually around day 14, day 15 of your menstrual cycle, you are going to ovulate. And so your ovary is going to release one of the eggs down into release it from the ovary, and it's going to travel down the fallopian tube, and it's waiting there in anticipation for sperm to come and fertilize, right? If you don't fertilize that egg in the viable time that egg is there, then another phase kicks in, which is called your luteal phase. And all these phases have different shifts in hormones that happen.
Okay.
So it's important to understand from a woman's perspective because every hormone has a function, right? And where you are in your cycle and how you can be strategic in using different recovery services to get the most benefit out of it, right? And so that's what we aim to do here, right? Everybody's cycle is going to be different. That's not to say that you're prohibited from doing certain recovery services at different points in your menstrual cycle. What I'm saying is have the awareness to know that your body might be on high alert right now, right? Because you have these hormone fluctuations in a particular phase of your cycle. So jumping into the cold plunge, your body might not appreciate that in that moment in time. And if that is your first time that you're coming to experience this, it might put you off for the rest of your life, for example, or it might make you very hesitant in trying to try it again. But the only reason that maybe your body responded in that moment in time was because of where you were in your menstrual cycle, and it just wasn't happy and wanting to accept that cold plunge in that moment, right? So that's where, when you come into like what we've developed here at Matter is to personalize that experience, right? So that it's meaningful and it's impactful, and that we can be strategic in how we use it based on where you are and what you're wanting to achieve out of this.
Yeah, I think that's a really interesting frame for the recovery stuff, right? Because we sort of take a baseball bat approach to it now of, hey, I'm feeling run down, let me do some stuff so I feel better. And what you're suggesting is if we just have a deeper understanding of what each of the recovery services provides, we can be strategic and we can optimize the specific recovery stimulus or effect that we want.
Yeah.
And look, I totally understand that information is best served with like a person in front of you and you understanding a little bit more history. But can you give us some sort of broad strokes of, depending on what phase you're in of your cycle, how you might want to sequence your therapies, or which one you should focus on if you just want to do one?
Yeah. Okay. So let's start with day one of your menstrual cycle. Day one of your menstrual cycle. So that's the first day of your period, 5 to 7 days approximately. That's the menstrual phase. And here the goal would be to try and recover and conserve energy, right? So if you had to think then about what the best way would be to sequence recovery services, you would want to do red light first in this particular phase. Why? Because red light is a more gentle form of recovery. But what it also does is it shifts the body into a sort of parasympathetic state. Okay, parasympathetic means it's your sort of calm, rest and digest state. Your sympathetic nervous system, if that's on fire, then think sympathetic, think stress, think fight or flight, right? So when you are menstruating, you have the lowest amount of estrogen and progesterone at that moment in time, okay? And you also have a very high inflammatory sensitivity that's going on. So we want to ease you into the recovery phase and conserve energy. So red light first. We want to sort of activate the mitochondria, which is done through red light therapy. And then we want to allow your body to shift from a sympathetic state to parasympathetic, right? So once you've done the red light therapy, the plan is, because of the physiology, that's how you would emerge from the red light therapy, slightly calmer, a little bit more zen. And then what we want to do is we want to put you in the hyperbaric chamber.
Okay.
The hyperbaric chamber works best when the body is in a calm, relaxed state. And so we want to put you into the hyperbaric chamber to give you that additional oxygen to help with the recovery and to kind of like give you a little bit of that energy boost, right? After hyperbaric, now we've flooded the body with oxygen in a high pressure environment. And the goal there is to get as much oxygen as we can into the different fluids within the body, so that when you step out of the hyperbaric chamber and you then proceed into our contrast room and you do infrared sauna is a very gentle way of heating the body. It works different to traditional sauna. Traditional sauna kind of heats up the air around, but what infrared does is it heats up your skin. So it's a gentle way, and we're not going to extreme temperatures that you can. Traditional saunas are generally a lot higher. So women can sit in the sauna and can tolerate the infrared sauna a lot better for an extended period of time. And you want to have that extended period of time because what you want is you want the activation of the proteins, right, that are released. And so that is also part of the recovery. So you now have, emerging from the H-bot, you've got, your body has got more oxygen than it had before, and this is now dissolved into various fluids. You step out, there's a pressure change. In hyperbaric, the magic happens when you leave the chamber. That's a whole other discussion too. You go into the sauna. You're now gently heating up your skin. And when that happens, your circulation, so causes vasodilation, which means your blood starts to flow a little bit better. And so there you're talking about like then the movement of that fluid that now has oxygenation is now able to flow better through the body. At this point in time, and many women who are used to doing, let's say, contrast therapy will tell you instinctively, I don't like doing it when I'm on my period, right?
Yep.
And not because, you know, they don't want to get, it's because of how their body responds in that moment of time. So you don't want to do a cold plunge during your period because you are in a state where you have the lowest levels of estrogen and progesterone, and you need to respect that. So you want to strategically support the body. So that's what happens through the menstrual phase. Then you're going on to the next phase, which is the follicular phase.
Before we get there, just to summarize it for people, just so I get it right as well.
Yeah.
In the first, let's just call it 1 to 7-ish days, the ideal, like ultimate sequence would be red light into hyperbaric, into
infrared sauna, skip the cold plunge.
Skip the cold plunge.
Yeah. Then you're supporting your body systems for what is happening at that moment in time.
And your hormones, yeah.
And your hormones, correct.
Because it helps you shift into a more parasympathetic rest and digest state so you can calm down.
Yeah.
And it helps oxygenate the right tissues and the right fluids.
Yeah.
And then it helps you chill out some more in the infrared sauna and promotes vasodilation and better circulation.
So you're getting extra sort of the benefits of the hyperbaric is now sort of being amplified, if you will, in the sauna because you're having this vasodilation, right?
And so can I ask, in that phase, when you have the time to do that sequence, what does that feel like? Like how much more recovered do you feel? Like how much deeper does the rest feel?
I think women come out and it's like like I feel like I can handle this now. You know, it's amazing for us. Like when we see people going into the contrast, and whether it's women who are only accessing the infrared and then they go and they have, you know, a lukewarm shower after and they come out, you can see it on their faces.
It's what they needed.
Yeah. They come in and you see the tension and they come out and there's this like, like that's exactly what I needed, right? The problem with a cold plunge is if you were to cold plunge in that time, you're giving your body a controlled stressor, which is going to activate your sympathetic nervous system. And cold plunge is done for that very reason, right? Because we want to train the nervous system to manage that particular controlled stressor so we can build up the resilience, right, over time.
Yep.
We're adapting to that stressor, right?
But we can just dose it in other phases.
Correct.
We can map that more aggressive acute sympathetic response to a phase where you can tolerate it and actually get the adaptations that we want.
Yeah. So then if you go into your follicular phase, right? So this is your period, you've stopped your period, so let's say day 7, and before you ovulate, right? The follicular phase, again, what's happening biologically is the ovary is kind of like preparing the egg for this grand release, right? Every month, ovulation. And so here, what's happening is over time, your estrogen levels in these days, you've gone from a very low estrogen progesterone level to your estrogen level starting to rise over these couple of days. And what that means is your tolerance to be able to handle stress is a lot better as well. So that means that we can pivot into changing up the sequencing of the recovery services that would be most beneficial to that particular phase of the month.
And so here, we do it.
you can start with high contrast because your body is able to tolerate it now, right? So you can go into the contrast suite and you can do infrared cold plunge and, sequence that over the period of time that you're there because you are able to manage it. What I would say is whether you're in the contrast room for 30 minutes or you're in there for an hour, your cold plunge should always be somewhere between 1 to 3 minutes. You don't need anything more than that. Yep. And listen to your body. That is most important. And don't just, if it's your first time, you don't ever want to just get in, right? You got to slowly work up to this. But that part of the month means hormonally, you're in a better position to be able to handle what we call this hormetic stress.
Yep, that acute spike.
Correct.
Yep.
So contrast room, do both. You can manage the cold plunge if you want. If you're a newbie, do a cold shower.
Yep.
Right? But end with the infrared sauna. So you're ending in a state where you're calmer. You have the vasodilation, right? Because that's what happens in the infrared sauna. And then we are going to take you into the hyperbaric chamber.
Damn, I guessed wrong.
You felt red light?
I'm trying to. Okay, so you go from contrast for 1 or 2 rounds in not a super intense way, ending on the infrared for vasodilation, better circulation, into the hyperbaric because
we want to now give your body the oxygen. We've now vasodilated. Because look, what we're doing here is we're giving you what we call a hormetic stress, which is the term that we use, right? It's a controlled stressor that's just enough to allow the body to adapt over time and build up that adaptation, right? Because that's what this is doing.
Yep.
So this is a good time to be able to do that in this part of your cycle.
Got it.
Hormonally, you can manage it. And then from there, the vasodilation means you've got really good blood flowing now. And then we're taking you into the hyperbaric oxygen chamber. And there we're giving you the extra oxygen and we're in that pressurized environment to elevate, again, the oxygen levels in the different fluid inside the body so that when you come out of the chamber, you're able to, that oxygen can diffuse into other areas of the body that maybe it wouldn't have received under normal circumstances. And then we're going to end with red light because what we want to do is, again, we want to kind of we've done this hormetic stress adaptation route and we've given you the oxygen. We now want to end with red light to kind of bring you back down and continue that, bring you into that parasympathetic state so that we can calm the nervous system down and that you're ready to go and feel that you have the capacity for the rest of the day.
Nice. Okay, so in this second phase, the follicular phase, the ideal sequence, if you have the time, is to do a couple of rounds of contrast, meaning a little bit of time in the cold plunge, no need to go too crazy with it, and then 10 to 15 minutes in the infrared sauna.
Yeah.
The preference would be to end in the infrared sauna. So you get the hormetic stress of the hot and the cold, but you're a little bit more parasympathetic when you leave, and you get the vasodilation, which means better circulation, which has you primed for the hyperbaric. And when you get into the hyperbaric, the oxygen can do its magic and start.
You're not coming, because if you were to reverse it, for example, let's imagine a scenario where you end with a cold plunge. If you've just come out of that cold plunge, what happens during cold plunge is you've got vasoconstriction, right? Now you're going into the hyperbaric chamber, and we want vasodilation because we want as much oxygen under that controlled environment in the chamber to be working its magic. So we've got to be, again, I go back to strategic on how we use these services.
Yeah, this nuance is so important because it's not that it won't work well. It's just that you could make it work better. By doing this little
tweaking, a little tweaking, right?
Okay, so then contrast for a couple of rounds into the hyperbaric to get the oxygen. And then into the red light to sink you back into a deeper parasympathetic state.
So you're leaving here zen.
Super good night of sleep.
Yeah.
Okay.
Yeah, and that would be the same. So I'm going to take you because, if you look at ovulation, that's 2 days, right? So this follicular phase up until you ovulate, because ovulation is your highest energy state within the cycle, right? Because all your hormones are at amazing levels. Again, the body is priming, so you always have to come back to physiology. That's how we approach it here, right? Physiology first, and then we move to what is the outcome. But we have to respect the physiology that's happening. So if you look at ovulation, best time of the month, women are their happiest. Why? Because the body was made to reproduce. And so to create that environment, everything is at its best, right? So what you're doing in the follicular phase, you also do during ovulation, because your body has the capacity to manage it, right? Because you're at this high energy state. So if you think about it really from a menstrual cycle standpoint, you could chop it into like 3 blocks, right? You've got the menstrual phase, no cold plunge. Body doesn't want it, doesn't like it. And you're always going to have exceptions, right? I'm talking about just average physiology, what's happening. Then you've got the follicular phase leading up to ovulation. Body is better primed to manage the hormetic stress that we want to cause that adaptation over time. And then, so we've gotten up to ovulation, and then we hit the last part of like the cycle, right? The luteal phase. So this is the period just before you are going to menstruate, okay? And again, you have various fluctuations in hormones that are starting to happen. So during this phase, what we want to focus on is supporting your nervous system, right? So it's more of a like supportive sequencing that we're doing. So in this phase, what we want to do is goal is support the nervous system. We start with a red light. We want to bring the body into a parasympathetic state so that it's ready and primed. From there, we want to go into the contrast, right? And you want to do the infrared sauna. And again, here I'll say this, it's optional at this point whether you want to do the cold plunge. And if you are going to do it, again, you want to keep it short, right? To 1 to 3 minutes as part of your cold plunge experience. From the infrared sauna, you then want to go into the hyperbaric chamber. Again, there it's about you're prepping the system, ready to receive the oxygen because you've got the vasodilation, etc. And after that, how you decide to sequence it, because usually what happens with our clients is they will come into the contrast room and they will do the sessions and back, alternate it, and then they will head into the hyperbaric chamber. But it's up to you whether if you have the time, you could also do the sauna, vasodilation, and now you're getting into the hyperbaric chamber. So you're getting that extra oxygen, and then you can do a cold plunge after. So that could be tweaked as well